Hey divas, welcome back to Closure with Jazzy. As you can probably see, I finally got a setup, well, kind of, for video episodes. I have no idea what this looks like. It's basically just a ring light tripod thing that my phone is currently attached to, and that's about it. So, again, that is something that you guys will have to be the judge of because I have no idea what it looks like right now. But I think it's a good starter, cutesy little setup. I'm just in my bed, my comfy little bed. I got my little candle going. I got my chai tea, and I'm ready to talk. I'm ready to rant. And this is only episode 2 of my podcast. And today I'm going to be talking about health, health and healthcare and medical stuff and all that kind of stuff. Um, I do have a cat, like I mentioned in my first episode, who might fuck with this setup. Like, not in that way, like she fucks with it. I mean, like, she's gonna fuck with it, probably. Um, she likes to terrorize everything that I do. So she's probably gonna walk by this tripod and like bump into it. So if at any point the video gets a little wobbly, that's probably why. So yeah, welcome back. This is Closure with Jazzy, and this is episode 2, and we're talking about health because I have a lot to say. Let me put that down. Okay, so this is really relevant with the timing of episodes because so badly do I want to get into talking about, you know, my relationships, my past relationships, because I have been dying to talk about those things. But without the like backstories and stuff, it's not gonna really make sense because there's a lot of like things in every relationship I've been in that have been a problem that tie into like my health and such. So without explaining that first before getting into the relationship episodes, it's not going to make sense. So that's why I'm doing this topic before I get into the relationship stuff so that it will make sense. Um so yeah, and I just realized I could totally clip this mic on my shirt, but I'm going to I'm going to hold it because I don't want to be awkward with my hands. Imagine I had this clipped on and then my hands are just like here. What am I supposed to do with my hands? I don't want to be awkward, so I'm gonna continue holding this mic, and it's gonna be great. But yeah, let's just get into it because oh my god, where do I start? Okay, so a little bit about me and my health is I have a lot of medical conditions, chronic illnesses, extra side things, random I let's we'll get into it. Um so as I go through the list of my medical conditions, I'm not going to get too into them because like who wants to do that? Like that I don't want to be seen as just my medical conditions, but also I want to talk about them, And some of them are a little like personal and like too TMI, so maybe not go into depth about them. But, anyways, let me just get straight to it. So, my biggest one being severe IBS-C with slow colonic transit. And this is something I mentioned in my first episode, the whole IBS shit, Oh, I have stomach issues too. I must have IB. No, this this shit, and this is the chronic illness. I don't think a lot of people know that IBS is a chronic illness. Um, but I've had IBS since I was born, basically, ever since I came out of the womb. And I'm 23 now. So from birth to now, 23 years, I haven't been able to find shit to help with this. And it's been a very long, exhausting, annoying journey. I will say that. Along with the IBS, I also have pelvic floor dysfunction. So fun. Then those two together, they're literally linked. So if one thing's bad, the other's gonna be bad too. Besides that, well, I'm lactose intolerant, so but that doesn't stop me. I literally can't like not eat dairy. I mean, I have found um what's the word I'm looking for? Um guys, I'm blanking. I don't even know. Um when it comes to milk, alternatives, that's the word I was looking for. For the longest time, it took me a long time to figure out which alternative was for me. Um, and mind you, it never used to be this bad either. Like when I was a kid, um, not only was my IBS at its worst, definitely could have died. Um, but the symptoms of everything, especially with like the lactose intolerance, wasn't as bad as it was now. Like a lot of things have actually like changed throughout the years or either gotten worse. So I used to be able to drink regular milk. Um, and then that's when, like, over the years, things started going sideways. I remember the last time I drank just regular milk was actually when I went to this city 2.5 hours away from where I live here because my mom was getting surgery. And Um, this was like a type of surgery she had to stay in the hospital overnight with. I was there to take her, pick her up, take care of her. You get the gist. And I remember picking up Starbucks for us, and I got like a hot chocolate because I don't really drink Starbucks anymore. But when I did, like, I'm not a big like drink person. So if I were to go to like coffee shops, it would either be like a hot chocolate or a chai tea of some kind. I'm not really big with different types of drinks and trying different drinks. I'm no. So I got a hot chocolate because it was colder in the year. And it was just a regular hot chocolate. Or no, it was a white hot chocolate. It was a white peppermint hot chocolate. So yeah, it was close to Christmas, I think. And I remember getting back to the hospital. I keep wanting to say hotel. Got back to the hospital and, we're just chilling, talking. She's in her little hospital bed, recovering and shit. And I'm sipping on this hot chocolate. And then, like, not even, I want to say 5 minutes later, after drinking this, I start getting the symptoms of like a regular episode for me. And I'll go into detail about what these episodes are too. And I remember like starting to feel all the symptoms. I'm like, oh fuck, here we go. And some would say that would be the best place to have an episode because I was in a hospital, but it's also really, really embarrassing. Um, so I'm like, oh shit, I need to find a bathroom and I need to go now. And not in the way that you're thinking. The toilet, not necessarily, no. When I have these episodes, basically what it is I start getting tunnel vision. I start sweating, like hot sweats constantly, extreme nausea, and cramping. It is horrible. And most of the times when I have these episodes, the only way to like calm them down is either sitting down on my mom's couch. I don't know what it is about that, but that shit is magic. Grateful. I'm so grateful for that couch. That couch has seen so many episodes. Um Otherwise, going to the bathroom and either like kneeling, just like not sitting on the floor, but like kind of kneeling in this like certain position and rocking back and forth, or getting in fetal position on the bathroom floor, on the cold, hard bathroom floor. And I know a lot of people can resonate that with that. Not specifically being with an IBS episode, but like, I don't know, if you're drunk, if you're hungover, everybody's been on that cold bathroom floor. And that's kind of how it was with me too. But sometimes laying down with nausea doesn't always help, which is why it was always like that squatting kneeling position. I don't really know how to describe it, to be honest, but um and then just waiting and praying and crying that this will go away soon, because I mean, it's unpredictable as fuck. Like, you never know. And so that would be the only way. So I'm like running around the hospital finding the closest bathroom, cuz like I don't remember if my mom's room had a bathroom, but because I get so embarrassed about having these episodes, the last thing I wanted to do was, be in close proximity and like, like, are you okay? Are you like I love when people care enough to ask me that, but when you're in the midst of having an episode, the last thing you want to constantly hear is, "Are you okay? Are you okay?" Because it kind of triggers your anxiety more. And that's, I mean, at least that's what happens for me. So I try to like get as far away as possible from anyone. And so I found a bathroom, I'm getting on the bathroom floor, I'm squatting, rocking back and forth, and it just was not going away. And this is when it like really, really started. Well, I don't want to say that, because if I give a little bit more of a deeper backstory, the worst that my IBS has ever been was when I was like, I don't even know how old I was. That's the thing. I was a kid. Um, it was like within the first couple years that we first moved here to America. And this was when it was really, really bad. And I hadn't of shit in weeks. Weeks to probably a month, couple months. I don't even know. It was a very, very long time. Um, and I'm positive that I had some kind of bowel obstruction. Maybe not like a full bowel obstruction, but like a partial one. I don't know. But because I hadn't have gone for so many weeks, I was basically just like rotting away on this couch. It was the most traumatic time of my childhood, I think. I was in severe, severe fucking pain every single day. I wasn't going to school because of it. It was horrible. Like, it's hard to describe because it's like so many different symptoms. And it's like, the hot flashes, the hot sweats, the constant cramping. And I'm not just talking like basic cramping, like period cramps. No, it's like severe pain in your abdomen constantly, and it just doesn't go away. And it's like severe, like it hurts really, really fucking bad. You can't do anything, you can't move, you can't eat, you can't do anything, along with nausea and, you know, all the horrible symptoms and side effects. And I just remember laying on this couch every single day for weeks on weeks on weeks on weeks, in severe pain every day, not being able to go to the bathroom because, I mean, the IBS I have, IBS-C, if you don't know, is constipation. And yeah, that went on for weeks. And at that time, we didn't really have insurance yet, so it's not like I could have gone to the ER or whatever. Would have That would have been the right thing to do, yeah, but again. So, and when things like that go on for so long, it can get like, imagine that went on for longer than it did, and I did have a bowel obstruction, or something else. Like, I very much could have died, and I was getting close to it. I mean, I don't want to say like extremely close, like I almost died. No, I'm just saying, like, you know, had things gotten worse, yeah, I probably would have. And Yeah, it's hard to think about because that's something that has like stuck with me for so long and I never really talk about it. So it's kind of weird talking about it, but yeah, the reason that I am still here today, my Lord and Savior, not Jesus Christ, um, enema, enema. If you've ever had to do an enema, you are, I consider you one of the strongest people ever, personally. Um, no idea what that even was when I was a kid, obviously. I remember one day my mom, she dragged me to the bathroom, laid me down on that floor, not to get graphic or anything, but well, shoved an enema up and if we had never discovered that, I fear I don't know if I'd be alive to this day. But that was the one thing that helped. And everything was solved. It's crazy, actually. And if you don't know what an enema is, I'm not gonna even describe that. You should look that up because it's gross. It's really gross, and no one should have to do it. But when you're in desperate times, desperate measures, that can be your ticket. And it was definitely my ticket because that was the one thing that actually genuinely like it just changed everything. And obviously after doing the enema, I was finally able to get things out and ever since then I was perfectly fine. Like I never had any kind of horrible flare up like that ever again until a few years later. So from childhood, like I went through most of middle school and in my entirety of high school without having anything close to what that was with my IBS. But that's also because like I was eating a lot in high school. We were living with my grandparents who made home cooked dinner every night. So I was eating a lot and good food. Um, I also did track for 3 years out of my high school career. I think I started sophomore year up until senior year, so obviously very active. The more you're active, the more your bowels, regulate. So, yeah, absolutely zero issues during that era. Um, it wasn't until one of my last relationships, not my most recent one, it was my relationship before my last recent one that triggered that again. Um, and this person, um, don't worry, they will have their own personalized episode. But um, I will say this person was very, very emotionally abusive, and one of the biggest narcissists I've ever met. And if you've ever survived a narcissistic relationship, you know. Do I even have to explain? It was rough. This man was picking fights with me every day over the stupidest fucking shit. Um, and I tried to block it out because it was so traumatic for me. So once I like actually get into these relationship episodes, I'm gonna have to like either jot things down and like really think about it so I don't forget anything. Because the thing with trauma is you try to block it out, you don't remember much anymore. And that's kind of what happened with my childhood because obviously I think we all have a little bit of childhood trauma. And if you've never, ever, ever had any trauma in your life, whether it's childhood trauma, any sort of abuse of any kind, like, how? Literally, how? I don't think I know a single person that has never gone through something traumatic, whether it was with family, friends, partners, whatever it is, any kind of abuse, whether it's emotional, physical, how? That must be nice. Do people actually exist who have never endured, like, okay, well, let me not just yap about other things. Um, but yes, this ex, I never knew. This is when I found out that certain people can actually trigger illnesses or your, like, medical conditions to come back, or just trigger like flare ups. And that's exactly what happened with this person. Um, because he was so emotionally abusive, picking fights with me every day. I was crying every single day, every night. Um, just constantly scared and like on edge, walking on eggshells, like what's he gonna argue about today? What's it gonna be about tomorrow? Um, and then like, every night, and the thing about him was I had my own apartment at the time, and then he lived with a bunch of roommates, and all in one big house. And the thing with him is he never wanted to spend a night alone. And he never wanted to specifically stay at my place. So, for me personally, when it comes to relationships, like if we both have our own places, whether we live with roommates or not, because I was living with a roommate, um, I want to be able to like split, you know, like tonight we stay the night at your place, and then tomorrow night we'll stay at my place, and then kind of like go back and forth with that. Or I'll spend a couple days at yours, and then we can switch around and you stay a couple nights at mine. Like, it's fair, because why would anyone want to like only be at one place all the time? But that's exactly how it was with this person. He always wanted me to be at his place every single day, every single night. I was never at my own place. And so every night I'm crying, he's arguing with me over the stupidest shit, and eventually I started getting nauseous again. And it would happen every single night to where I could never sleep. It started with the nausea, and then came in the cramping, and then the sweating, and then the tunnel vision. Like, oh, it's happening again. And that's when I figured, that's when it clicked. I was like, oh, so people can actually trigger that shit. That's crazy. Yeah. So that went on for, it was actually, now that I think about it, it was a short relationship. I think it was like 4 months total. Thank God it wasn't any longer than that. And yeah, that's kind of when it started happening again. So after that, fast forward to what I was just talking about, when I would go to my mom's surgeries with her, and then that happens, and then ever since then, and that night too at the hospital. So what ended up happening is, um, I ended up going back to the hotel because I obviously had to stay in the hotel while she stayed overnight in the hospital, and you're not allowed to stay with them. So I was in a hotel, and I'm like, I gotta go. I'm not feeling good. I'm having an episode, and I just need to be away. And so I left the hospital. I go back to the hotel, and it does not go away. It's like the worst of the worst it's ever been. And so, and there's probably going to be some people listening like, well, why don't you just throw up? Okay, I have emetophobia. If you don't know what that is, it's fear of, yeah. Um, I will do anything not to get to that point. It's a phobia. It's a literal phobia of mine. And so when it comes to nausea, it's like being shot. It's like hearing gunshots to me. Hearing other people throw up, seeing it, hearing it, talking about it, it makes it's like I'm in a war zone. I'm in the fields, I'm in the trenches, and gunshots are going off. I can't do it. And so I get back to the hotel and I'm just pacing back and forth in this hotel room, hunched over, because that seemed to be like the only way to kind of calm it down. So picture me hunched over, walking, pacing back and forth in this hotel room, crying. And there was actually times where I was like, okay, I give up. I'm just gonna actually try and, as much as I don't want to because of my phobia. So I'm like sitting next to the toilet, and this is where the nausea gets at its like all time high, and nothing, nothing's happening. But it's still that feeling you get when you're about to, just constant, doesn't go away. So I'm like, what the fuck? What do I do? I'm like panicking at this point, and I call my mom. I'm like, hey, like, I'm panicking. I don't know what to do. I'm having a really bad episode and it's not going away. And so she obviously can't come get me. I can't drive. So she called me an ambulance. So in a this ambulance comes to the hotel. Mind you, that's the most embarrassing thing ever. Just standing outside of the hotel waiting for an ambulance to come pick you up has got to be the most humbling experience that I've ever had. I will never forget that. And then there's people coming in and out of the hotel just looking at me like crying and like pacing and going through it. So that was fun. And the ambulance arrives and I get in the ambulance. They give me, I'm pretty sure it was a meprazole. It's like a thing for nausea, and it was the one where you like place it on your tongue and it like dissolves, and then it's like an instant working one. They gave me that, and literally boom, I was fine. I was literally fine. So, but they take me to the ER anyway. Obviously, I already made it as far as getting in the fucking ambulance. So, get to the ER. Um, I was left for a very long time. So I hate ERs. I've been in the ER many times for IBS, and every single time I've just been kind of like forgotten about because it's not as urgent. But yeah. So, and you know, at that time, I didn't exactly know it was IBS that was causing all of that. Um, and finally, I think like an hour later, I remember falling asleep because it took that long. So I fell asleep in the ER bed, and this doctor came in, looks at my like health history for like a second, and is like, "It's just your IBS. Just take a laxative, you'll be fine." um, if you're someone with IBS, you understand that that's like the worst thing a doctor could say to you. Everything gets blamed on your IBS, and it's always, have you tried taking a laxative? Have you tried drinking water? Do you have anxiety? Maybe you should get. This makes me want to. Obviously, at that time, he was right about one thing, it was my IBS. But when it comes to severe constipation, right? Severe constipation. The last thing that you want to do is prescribe a fucking laxative. Do you under that makes things worse, believe it or not. Like, if you're constipated, take a laxative, boom, it works. You're good, right? Okay. But imagine you're severely constipated, like severely, and you have been your entire life. There have been times where, the less I knew about this condition that I had, I did take that advice. I'm like, okay, I'll take a laxative, whatever. End up in the ER. I've had laxatives send me back to the ER because you can't really mix laxatives in severe constipation. That doesn't that no. So, I'm pissed off. I start crying and yelling at the doctor like, "What do you fucking mean? Take a laxative? What?" Okay. So, this was the night that I got prescribed a bunch of meds for the first time. Because let me clarify, before this night, I wasn't taking any medications for anything. So this is where my medication side started. And ever since then, I've been on Dancitron, which is for nausea. I take that twice a day. Um, Famotidine is for GERD or acid reflux. I take that once a night. And then I started off with lubiprostone, which is an IBS medication for constipation. Um, and obviously, a part of today's rant, that didn't do shit, literally. Um, and I've been on this very long journey of trying to find an actual medication that will actually help me. Um, but that was when I first started taking meds. And they just kept piling up and piling up and piling up. And obviously, if one isn't working, then you have to go through trial and error with a bunch of other meds, and it's exhausting. It's exhausting. Um, I'm very grateful for the ondansetron. I will say that. I think that is one that I will never give up on because, as someone with the literal phobia of that, that's like she's my bestie. Um, but that doesn't also like I do still get nauseous, but it's not as intense with being on ondansetron, so I'm grateful for that. But um, yeah, so basically, um, after that, I start all these meds and I'm going through a bunch of trial and errors and getting prescribed other meds and more meds and this meds. Um, so here's the thing. I just recently found out that um, my IBS-C is not only severe, but different than what I thought it would be. Because all my life, I've known that I do have IBS-C, but that's it. I didn't know that there were subtypes of IBS, especially within, because you can have IBS-C, you can have IBS-D, which is exactly what it sounds like, constipation, diarrhea, and then there's the one that's both of them. But within each of those, there are subtypes. And I just learned this. So I've just learned that mine is the severe IBS-C with slow colonic transit. And what that basically is like your bowels have a harder time actually moving on their own. And that's why, nothing comes out, or it's harder to go, or you're straining, blah, blah, blah. I don't want to get too into it because it's like kind of gross to talk about and personal and embarrassing. So, yeah, just found that out. So far, the only meds I've ever been prescribed my entire life, is lubiprostone and Linzess. Linzess is the literal medication for IBS-C, or so we thought. That's what it's labeled as, but that's because we didn't know what was actually going on until I did the research. Me, by the way, I found this all out. And I do have pants on, by the way. I just want to throw that out there. I have shorts on. Don't mind that. Yeah. So, also, I just want to point out that I'm wearing like a white on white, like sweater short combo right now kind of looks like I'm going to a party of a specific person. I just wanted to look somewhat cute and comfy, but I'm just probably blending in with the bed too. Okay, sorry, I keep getting distracted. So, yeah, meds. So, it has been a constant battle for me to figure out something that will actually help. Mind you, it took me 22 years to even get a colonoscopy. 22 fucking years. 22. I got referred to my very first gastroenterologist last year or maybe the year before. I was 22 and it was a couple hours away, but I mean it is what it is at this point. I'll take anything. My first ever appointment with this gastroenterologist. You know, my mom and I were both, I mean, because she knows a lot too. I mean, she's been there through all of it. She gave birth to me, she knows. And we're both going back and forth talking about my IBS and stuff. And she pauses and she's like, "Have you ever had a colonoscopy?" And I'm like, "No." And she's like, "You've never had a colonoscopy?" Girl, girl, literally, I know. Why do you think I'm here? Like, I've been saying. So, I had my first colonoscopy and endoscopy uh last year. Around this time actually. Last year. Um and it was the weirdest experience ever, I think. Um and I mean, I don't remember much cuz you get put under obviously, and I just remember like going to the clinic and then I'm in the bed and I have the gown on and they wheel me into the operation room thingy area and she puts like the oxygen stuff in my nose and then the mask. I don't know the terms, I'm sorry. I work in healthcare, but not in that sense. Like, I am EVS, not a nurse, so I don't know all the terms for that stuff. But, anyways, yeah. And I remember her being like, have a good nap as she's putting, like, the thingy on. And I'm like, okay. Black after that. And I wake up back in the room that I started in. And oh my god, it was such a good feeling. I'm not gonna lie. That's probably the best sleep I've ever gotten. I know probably a lot of people can say the same thing about being put under. Like, it genuinely, like, I woke up like, holy shit. Like, wow. And, that was also my first ever time being put under, so I didn't even know what to expect. But I enjoyed it. I really did. Um, and of course, out of that, they found nothing wrong. But that's also because IBS doesn't show up on any kind of imagery. It could literally look like your bowels are perfectly fine, everything's normal, whatever. But that's because you're not gonna see the IBS. You know what I mean? I don't know, that might sound confusing, but it was a huge disappointment, but I do remember how lovely it was to finally eat for the first time after, because you can't eat anything. For me, the prep was awful. They give you like a huge gallon of water to drink, but it's not water, obviously. And they're nice enough to give you a flavoring packet, which is lemon. Here's my cat. Um, and I mean, it's better. I will say honestly, the prep that I got for the colonoscopy was way better than the prep that I got for a CT scan with contrast. It was like two different prep methods. Like the CT scan, it was like kind of like this milky texture of drink that we were supposed to drink, and I had to drink 2 bottles of it. And it was like berry flavored. Did not taste like berry. It was disgusting. I couldn't keep it down. I could not drink that thing, and I didn't finish it. But uh, it was good enough, I guess, for them. That was awful. That was horrible. Ew. But the prep for the colonoscopy was just this gallon of the water stuff that you drink. You have to drink the whole gallon. Um, and the taste wasn't as bad as the other prep, but it's still bad. Any kind of prep for anything, it's gonna be bad in some level. But it was tolerable. And I did it. I did the prep correctly and to the fullest. But goddamn, you can't eat. You can't eat anything for like I can't remember if it was like 8 or 24 hours or some I don't remember. But I couldn't eat for a very long time. So I'm like starving. And then after the procedure was done, we went straight to Chick-fil-A and crumble. And it was the best. It was like it was so good. Like last meal type shit. It was so good and I love everything about it. Anyways, so before I just get too into like personal stories, I just want to say like my medical side of things, like so we have the IBS, pelvic floor dysfunction, um and I have a bunch of like other random stuff too. Like I have two joints that are out of place, one being in my chest and I forgot where the other one was. I have had carpal tunnel and osteoarthritis in my fingers, but I already did physical therapy for both those things. Way better now. Um, but I still have this chest rib out of place, and it's just there, I guess. I don't even know. Um, Obviously, I have anxiety, I have PTSD, I have depression. But those are more medical sides of things. I have a long list, and I can't seem to remember all of it right now, but those are just a few examples, right? IBS and pelvic floor dysfunction being the main ones. And I feel like with the way that healthcare is, I'm ready to just like not even do anything anymore. Like, and as much as that sucks because if I don't do anything, then I'm going to suffer. But mind you, as I've just explained, it took 22 years to even just get a fucking colonoscopy for my IBS. Just to like actually take a look, like, what's going on? Something's clearly up. 22 years. Then I get medicated. 22 years. Um, Ever since then though, because obviously since then, I still have my gastroenterologist. Um, I have a gynecologist and, my regular primary doctor and I obviously have a lot of appointments with all of them because of all my medical issues. And I've gotten nowhere with any of them. Still, literally still. And this is what irritates me. Because with the gastro side of everything, like, it's just been a bunch of trial and error, medications. I started with the lubiprostone, didn't work. I tried different dosages, didn't work. Then Linzess, the actual literal medication specifically for IBS-C. Didn't work. Tried all of the dosages. Didn't work. Now I'm not taking anything currently because my past medications, even though they weren't doing anything, are no longer authorized. So I haven't been taking anything for my IBS for the last week, I want to say. I've been going through hell. I have been going through it. Um, I've been on and off the phone with my gastroenterologist. Well, not him himself. Um, and I say, okay, wait, before I get into that, when I first met my gastroenterologist, she was a she, but she ended up leaving her practice. So then I got referred to another one in the same clinic, but just a different, you know. And he's a him. So I went from her to him, and mind you, every time I call, they never pick up. We always communicate through voicemails or texts. I'm always calling them, they never pick up, so then I'm constantly leaving voicemails, and then I don't hear from them for another week, and then they'll either just like send a text message or eventually call me back. um and God, today, um I call. I attempt to. I call. Um and of course, nobody picks up, so I have to leave a voicemail. And I'm leaving a voicemail and I'm like, "Hey, I haven't been taking anything for my IBS for the last week. I am suffering. I'm having episodes again every single night. Help me." And um previously I called them and told them, "Hey, maybe we should try a different type of medication." There's this one medication, it's called Motegrity. And Motegrity is an IBS medication that targets motility, not fluid secretion, which is what the Linzess and the lubiprostone were. They were more focused on getting fluid intake into the gut rather than motility. That's not what I need. I need motility. And so Motegrity, it's a motility based medication. I did the research, I found out about it. Of course, I have to do everything my fucking self now. Um, and so I'm the one that brought it up with them. I left it in the voicemail like, "Hey, maybe we should try this. Can you please prescribe me it? I feel like it would really help." Um, and they never called me back, but they sent me a text message basically saying like, "We prescribed Motegrity, like we'll wait if insurance will cover it or not. We'll keep you updated, blah blah blah." That was 2 weeks ago. 2 or 3 weeks ago. And then a week ago, it got denied. And they were like, "We're gonna discuss more on next steps and we'll keep you updated." That was last week. Now it's this week. I'm like, "Okay, I haven't heard shit. Hello, I'm suffering. I need something immediately. Help." So that's kind of what my voicemail was today. Like, I really need you guys to treat this with urgency because I feel like I've just been like all by myself with this. Like, why am I the one that's researching everything myself, finding all of this out myself, and basically ordering you to prescribe me the like you're the gastroenterologist. You're the doctor. Why am I doing your job for free? It makes no sense to me. Why? And it's so annoying and it's so frustrating because that's how it's been my whole life too. Like, why are you in this field if you're not gonna actually try to help me? Like, why do you get paid? Like, how are you in this position if you're just not gonna? And like, I know insurance plays a big part of all of this, but also the fact that I'm finding all this information, like, "Oh shit, we've actually been focusing on the completely wrong medication this whole time that's not actually targeting what needs to be targeted. Um, we need this medication, which will target the motility side of things, which is medically necessary. Um, these are the medications, the generics, the whatever, prescribe it. Like the fact that I'm basically now telling them what to do when they should be the one telling me, like, oh, so you have this, we're gonna target this, we're gonna prescribe you this medication that will do this and help with this. But no, that's me. Apparently, that's me. Like I'm talking to them like they're the patient and I'm the fucking gastroenterologist. And I'm not getting paid. What? It makes no sense to me. And and today I'm like, okay, so the Motegrity got denied for insurance to get covered. You said you would keep me updated and you're working on something else, except it's been a week, and I haven't been on anything for a week because I can't even bounce back to my old medications because they're no longer authorized. So what the hello? I'm suffering. I'm literally suffering. This is urgent. And I eventually got a call back and it was just super dismissive, like, yeah, like we're trying to come up with something, and when we prescribe a medication, like it goes for both name brand and generic, so it doesn't matter how we write a prescription, like it still counts for both generic or brand name, so like technically we that also went towards the generic. And she was like, well, can you call your insurance and see what they actually do cover? Again, why is this my responsibility? You're like at this point, I might as well just be my own gastroenterologist because what do you mean I'm doing everything myself? What do you mean? I'm going to you as my gastroenterologist for you to help me figure out my chronic illness and help me and prescribe me what I need to help with it because obviously there is no cure. There's no cure for IBS. There just isn't. There should be, but there is not. And it's something that has like barely any education on or research or any. Nobody knows what the fuck IBS really is. Nobody's really done any studies on it. Anything. So I'm kind of in the dark here. Um and it was just so frustrating that I actually started crying over the phone. Because when I get really frustrated, I start crying. And I know a lot of people could probably relate to that. Um we're just girls. But it's also a trauma response, so um but yeah, and so that phone call ends and I'm like, okay, well, I guess I will look. I'm not gonna call them, but I'll look. And what I did is you can actually like go on your insurance website and search for a specific drug, and see if it is covered and what the copay would be and blah blah blah. And that's what I did. So I went into my insurance website and I looked up both the name brand, which is Motegrity, and then the generic, which is like I already forgot the name of it. Whatever the generic is for Motegrity. I can't remember what it was called. Looked both of them up. Both are covered under tier 3. And tier 3 is like you need prior authorization and documentation or appeal it. So what they should have done when it got denied was appeal it. First of all, appeal that shit. Lord knows appealing does actually do wonders. I did that with unemployment, appealed it, literally had the hearing, won $2,000. Over $2,000. Biggest flex. That could be a different story. Because I would love to get into that story. Um, but anyways, yeah. That's what they should have done, appeal it Or maybe if it's gotten to the point where it's gotten denied, maybe did I provide all the necessary information? Should I, like, they're both covered, okay? They're both covered. They're just not doing their jobs correctly. And I hate to sound so harsh, but as someone who's dealt with this for their entire life, and no, it gets frustrating. It really does. And I shouldn't have to do everything myself. I'm not even licensed. I don't have a fucking degree. And I'm figuring this all out myself. Anyway, so the last thing that I said to them today was basically like, okay, hey, like both Motegrity and the generic are covered by my insurance under tier 3, which means you guys have to either appeal it or provide more documentation for them that literally proves and shows them, like, hey, she needs this shit. Because if you haven't already done that, then maybe that's why. Because they shouldn't deny that. Like, it's all there. If you're sending the correct information over to them, there is no reason for them to deny that. Like, what? So, they need to literally, like, I don't know what they're doing. I really don't. Clearly nothing, but like, you need to explain, like, oh, this medication is medically necessary for her. Here's all the proof and documentation that, she's even tried past medications before. Because a lot of times, insurance, like, they make you try other medications first in order to start a specific one. And that's exactly what I did. The lubiprostone and the Linzess, like, already tried those, and obviously they failed. So that already gives me more chance to get this prescription. But I have a feeling they're just not providing everything correctly. And yeah, so I'll probably hear back from them in about a week, maybe two. We'll see. And I'll just keep suffering, I guess. And then, like, same thing with the pelvic floor stuff. Like, I just recently started going to a gynecologist, and we've obviously been talking about the symptoms that I've been having with that, and this is more of like a more personal, deeper thing to talk about because it does involve like sex life. I mean, if I were to say it, like, long story short, it's really hard for me to engage and perform in performances sexually because pelvic floor dysfunction, like, not only that, like, I have pelvic floor dysfunction, a low pelvic bone, and vaginismus, which is basically a condition where, like, I call it pussy PTSD. And that's because your muscles down there are always like, just tight. I hate to say it. I hate to say that word, but that's literally what it is. They're just tight and they don't ever loosen up. And so when you try to engage in, you know, sex, it just doesn't work. It doesn't. And, if you force it or, just in general, um, it's unbearably painful. The whole side of it, um, intercourse, it's so painful. And that's something that I've been struggling with for a very, very long time. And it's definitely affected um, some relationships, mainly my most recent one that I'll get into. It's really sad too that it see, and that's where it starts getting emotional for me because it's like some of these like illnesses that I have, like, they not only does it affect my physical health, but it affects my social life. It affects my relationships. I've lost a lot of things due to these medical illnesses, and trying not to cry about it on video in 4K because that's embarrassing, but that's how much this shit just like really affects me because it's like I've literally been broken up with over conditions that I can't control, conditions that I can't just immediately fix just like that. Like it sucks. It really does suck. And this entire time, I've been trying to figure everything for 23 years. I've been trying to figure it out and get somewhere with it because I don't want it to affect my life in all aspects. Like it sucks. It really sucks. Like imagine getting broken up with and getting cheated on simply because I you can't fucking hammer my shit like because it hurts too much. Imagine getting broken up with and cheated on with someone you thought was gonna be your future over sex because you can't perform properly because of fucking pelvic floor dysfunction and your muscles down there are just always because it's from trauma and you can't do anything about it and the only way to really kind of like help that is physical therapy. And as much as I hate physical therapy because that's the only answer I've ever gotten with a lot of medical things, like getting referred to therapy, physical therapy is like the hardest thing ever. It takes forever. And I remember seeing a gynecologist last year about the same issue before it got worse. And it was physical therapy. Like, we'll refer you to physical therapy. A whole year had gone by until I got a phone call. Then I finally, a year later, I got a phone call like, "Hey, like you've been on the list for physical therapy. We can get you in now." And at that point, because I wasn't sexually active, I wasn't in a relationship, I didn't feel like I needed it anymore because there was no point. Like, I'm not sexually active. Like, so, I declined it. And obviously, the stupidest thing I did. And, same thing is happening again now. Like, the only thing that they were able to do was refer me back to the pelvic floor physical therapy. And, it's been 3 months so far. Haven't heard shit. And my gynecologist even told me, well, you've been on the list since September. It usually only takes 3 months. Okay, well, it's December. Anyways, so yeah, no, it's this whole health journey has been such a struggle, and it really affects everything in my life from social life, medical, physical, mental. And the worst thing that has happened to me this year has probably got to be being in the longest relationship that I've ever been in my entire life with someone I genuinely thought was going to be my future. Um, Marriage, kids, embarrassingly, all of that shit. Only to get cheated on and broken up with um, over sex. And I'm still healing, or trying to at least. This was very recent. Um, like it hasn't even been a whole month. It's been a couple weeks since this all ended abruptly. Um, and it's hard. It's definitely been hard. Um, I don't think I'll ever be able to heal from that. It's definitely altered my brain in many ways that I don't think I'll ever be able to move past from. there's more to it as well that I will be getting into in a separate episode specifically all about that. Um and I want so badly to be able to just get that episode over and done with right now, but because it is so fresh, and if I start promoting this podcast and a bunch of local people here, they know the person, and it gets talked about, it gets sent around, and I'm aware that that could happen anyway. But the thing is I'm sharing my side of things. I'm sharing my experience, so it's fair game, to be honest. Like, that's exactly why I made this podcast, to work on closure, but also be able to have the freedom to just speak my mind and talk about things in my life that has happened. And you know I feel like a lot of things that I will be talking about, a lot of people can relate with, and we can kind of kiki together and find some sort of closure with each other. um but yeah, I think the whole point of this is like healthcare sucks. It really does suck. Um, and I've learned that you kind of just have to do everything yourself these days. You, not necessarily diagnose yourself, but like you gotta just do all the research yourself. You have to literally tell all your doctors or whatever it is what you want them to do. Most of the times they'll just do what you say, which is just ironic considering that they're the fucking doctor and they're supposed to be doing this research for you. If not, they should already know because they're a doctor. Um, but that's just not the case anymore. And this is why CEOs. I'll take that. Mm, let me not go there. I won't go there. But I think you know what I was about to say there, and I'm sorry, but it's true. It is true because it gets to a point. It really does. It gets to a point. Like, it's frustrating as hell. It really is. And you know, it's so bad that it's affecting relationships. It's affecting my mental health, my physical health. Like, I can't even perform, you know, at work without having to take multiple breaks a day to because symptoms and fucking just not being able to perform to my fullest potential. And with the pelvic stuff, the pelvic floor stuff, like, I can't even keep a goddamn relationship because I can't perform in bed that they want me to because it physically pains me, like, extremely, so bad to the point that I cannot go on. And it's not just that too. Another thing I forgot to mention is TMJ. TMJ, it's like a jaw disorder. Um, I was born with this one too, I'm pretty sure, because my mom had it. But TMJ, whole this is where it gets tricky to talk about because obviously I don't want to get too TMI, and like, I don't really know how podcasts work in the sense of like what all you can say on camera. But when it comes to oral, we'll just yeah. When it comes to oral, yeah, I cannot do that. I really can't. I really, 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 really try. I try my best. And if I need to take breaks, I will take breaks. And I'll keep going, but just have to take thousands of breaks in between. Because with TMJ, it doesn't matter how big, how small, how girthy, whatever. Um, it's a jaw thing. You're opening your mouth to a certain extent. Your jaw starts to lock or pop. Like, for me personally, like, um my jaw is constantly popping. Like, whenever I open my mouth, um which like this right now is fine. But if I'm opening my mouth to an extent where like my jaw is like used more, then yes, that's where it starts having problems. And so when it comes to even dentist appointments, like when I'm getting a filling or and you have to like open your mouth wide enough for them to obviously get in there and do their thing. Um I can't even do that. I can't even sit through a full dentist appointment without having to take so many breaks because of my jaw, my TMJ. It's that bad. And so when it comes to, again, the, intimate sides of everything in relationships, there so far have been two men that I have dated that have both ended up the exact same as each other with making sex and head way more important than everything else in a relationship. And so if they're not getting that whenever they want it, or the way that they want it, um, you're done. I'm gonna cheat on you and I'm gonna leave you because that's just too important to me. And yeah, no, can't do it. Sorry. Like, and I get it to an extent. Like, fuck, like if I, for example, if I was dating someone and sorry, mom, this might be a little TMI, and I was dating a guy that would never eat, you know, eat down there, like ever. Yeah, I'd kind of be a little, but I wouldn't break up with them over it. Are you kidding me? I wouldn't cheat on them over it. I'd have a conversation with them like, "Hey, like is there a reason why you don't do this? Like is there a chance you would or like is there something I can do to help you kind of get comfortable with it or whatever the issue may be, like the whole point of a communication or of a oh my god, sorry. I think I'm having a stroke. The whole point of a relationship is communication, you know? Like I don't know what other people think of about when they're in a relationship, like the whole point of it, like because for me personally, like I'm trying to find someone to lock down with and spend the rest of my life with. Like I want to grow old with you. I want you to be my best friend, but also my lover, my partner. I want you to always have my back. I want to maybe eventually get married or have kids or whatever, even though I'm not too keen on any of those. But maybe like that's the whole intent behind everything. But it seems like a lot of men in this generation are just looking for someone with a throat and to fuck, basically. And I'm coming from someone who has had these experiences with a couple men now. It's like, what do you guys even think about when you want a relationship? Like, do people seriously not think about like, oh, I want to find someone to lock in with. I want to grow old with them. I want to build a family with them. I want to or is it just "Oh, I'm just looking for a baddie with a fatty that I can fuck whenever I want. She'll never get tired or and she got a throat and she give me a head whenever I want." That's fucking disgusting. I'm sorry, but that's and this is gonna be such an episode, such a fun episode for me to record when the time comes because woo! Oh, it's gonna be one. It's gonna be one for sure. But yeah, I'm just yeah, okay. Let me check the time cuz okay. I do have a dentist appointment that I need to head to right now actually. But just to wrap things up real fast, healthcare sucks. You're basically your own doctor, and if you have chronic illnesses or any kind of medical conditions or whatever, I feel you. And it sucks, and knowing that there's literally nothing to help, no one to help, um, it sucks. And I could rant about it even more if I had the time, but I keep getting distracted. So, but I do have a time limit and I do have an appointment to get to, a dentist appointment. So fun because part of my treatment for TMJ is I'm actually getting braces on next week and I'm terrified. Um, Braces at 23 years old is kind of embarrassing, but if it helps the TMJ, it helps the TMJ. Not that I really need it anymore because I'm no longer in a relationship and probably will never get into another one ever again. Thank you for ruining everything for me. If you know who you know who you are. You're probably not watching this, but if you aren't, thank you. Um but anyways, yeah. That's kind of what this whole episode was about today, which is health, the health side of things, and rants and the annoying side of healthcare and blah blah blah, but also a lot of the things that I mentioned about myself and my personal health conditions and illnesses will also help you guys as listeners for future episodes when I start talking about my previous relationships, because a lot of those unfortunately do tie into the medical side of things, um, unfortunately, and that's just the way it is. So at least now it will make more sense going forward because you'll know what I'm talking about. So hopefully this did help with that and will help in the future. With the next couple episodes that will be more tailored towards relationships and getting those stories out. But yeah, no, I'm excited. I'm so excited to get into those specific episodes, but obviously gotta be patient, and I have to be patient with myself because Lord knows that would have been my very first episode, probably is my most recent relationship. But we're gonna do it properly. But yes, if you've made it this far, thank you so much for listening. I think I only sipped my chai tea once, and hopefully this setup looks okay for the video episodes. Again, not a professional, so I don't have all the fancy equipment or, you know, an actual setup, but hopefully it works. I hope so. And now you guys have a face to the voice. Um Usually my signature look is curly hair, but I genuinely haven't had the motivation to try ever since everything went down with my last relationship. It has broken me. Um, Same with makeup. This is the first time that I've done somewhat of a full face of makeup in weeks, maybe longer. I don't know. So, yeah, it's been hard, but here we are. But yeah, again, let me stop yapping. I need to get going. But thank you guys so much if you've made it this far again for listening. Again, this is Closure with me, Jazzy. Um Another episode will be out obviously next week, same time. We'll get more closer towards relationship stuff, and um I haven't decided what next episode's going to be, but we'll get there. But yeah, um love you so much. Thank you for listening, divas, and I will see you next week. Oh, also, FYI, I still haven't figured out the whole intro and outro sound thing. I attempted, but I couldn't find anything. I also still don't know how that shit works. So, it's just gonna be me talking again, just straight to the point, and then straight to ending it, because I don't know how this works. I need like an editor or something or someone. I don't know, but I don't. So, we're learning together, and eventually maybe I'll get there. Okay? All right. Bye, divas. Thank you.